As we have seen in Module 5.4, the integument is a cutaneous membrane with an epidermis made of epithelial tissue and a dermis made of connective tissue. Deep to the dermis is a layer of loose connective tissue called the hypodermis, or subcutaneous layer. As mentioned in Module 5.4, the boundary between the dermis and hypodermis is generally indistinct because the connective tissue fibers of the reticular layer of the dermis are extensively interwoven with those of the hypodermis. While the hypodermis is not technically a part of the integument, we examined its structure and function in Module 5.5 because it's intimately related with the skin. Let's begin our study of the hypodermis now. The hypodermis sits below the cutaneous membrane of skin and consists of loose connective tissue. Particularly, it is areolar tissue. And, as we learned in Module 4.4, loose areolar tissue with many fat cells is more specifically classified as adipose tissue. Thus, the fat found here is often called subcutaneous fat. Subcutaneous fat actually makes up about 80% of all body fat. The remaining body fat is called visceral fat because it is associated with visceral organs. The adipose cells of subcutaneous fat provide infants and small children with a layer of baby fat, which helps to reduce heat loss. Subcutaneous fat also serves as an energy reserve and a shock absorber for the rough and tumble activities of our early years. As we grow and mature, the distribution of subcutaneous fat changes. The greatest change takes place in response to circulating sex hormones at puberty. Beginning at puberty, men accumulate subcutaneous fat at the neck, upper arms, along the lower back, and over the buttocks. Women do so in the breasts, buttocks, hips, and thighs. In both male and female adults, the subcutaneous layer of the backs of the hands and the upper surfaces of the feet contain very few fat cells. But both women and men may accumulate distressing amounts of adipose tissue in the abdominal region, producing a prominent pot belly. An excessive amount of such abdominal fat, also called central adiposity, is strongly correlated with cardiovascular disease. The hypodermis is quite elastic. Only its superficial region contains large arteries and veins. The venous circulation of this region contains a substantial amount of blood, and much of this volume will shift to the general circulation if these veins constrict. For that reason, we often describe the skin as a blood reservoir. The rest of the hypodermis contains a limited number of capillaries and no vital organs. This last characteristic makes subcutaneous injection by means of a hypodermic needle a useful method of administering drugs. The hypodermis has also been classified historically as a superficial fascia. It is worth briefly discussing the term fascia at this point. A fascia, or plural fasciae, is a band or sheet of connective tissue, primarily collagen, beneath the skin that attaches, stabilizes, encloses, and separates muscles and other internal organs. Fascia is classified by layer as superficial fascia, deep fascia, and visceral or parietal fascia. Or they can be classified by their function and/or anatomical location. Historically, there have been some differences as to how to classify these structures. In 1955, an international standard on human anatomic terminology called the Nomina Anatomica was developed. It was eventually replaced in 1997 by the Terminologia Anatomica. One difference between the two systems is in regard to their classification of the hypodermis as superficial fascia. The older Nomina Anatomica classifies the hypodermis as superficial fascia, and the Terminologia Anatomica does not. Nevertheless, you may see the hypodermis referred to as superficial fascia in some writings, and this is why. Finally, on a clinically relevant note, let's discuss the topic of liposuction, a surgical procedure that targets the adipose tissue of the hypodermis. The accumulation of excess amounts of adipose tissue increases a person's risk of diseases, such as diabetes, stroke, and other serious conditions. Dietary restrictions and increased physical activity can promote weight loss and reduce these risks. However, a surgical procedure called liposuction, or lipoplasty, or suction-assisted lipectomy often promises a quick fix. There are variations to this procedure, and a lot of advancements have been made since its initial development in the 1970s. Overall, in this procedure, subcutaneous adipose tissue is removed through a tube inserted deep into the skin. It is quite common for the physician to inject fluids prior to removing the fatty tissue. The fluids contain various chemicals that each play important roles. The fluids contain large volumes of dilute anesthetics, such as lignocaine, and additives such as sodium bicarbonate, which causes the tissue to swell and become turgid, creating a plane from which suction of fat becomes easier. Epinephrine, a vasoconstrictor, decreases blood flow. Because connective tissue is highly vascular, the addition of epinephrine reduces bleeding induced by the procedure. Other chemicals may help dissolve the fat, facilitating the removal of adipose cells with a cannula. Adipose tissue tears relatively easily, and suction applied to the tube rips chunks of adipose tissue from the body. After liposuction, the skin is loose-fitting for a period until it recoils. A tight-fitting garment is usually worn during recovery. Liposuction may sound like an easy way to remove unwanted fat, but in practice it can be dangerous. There are risks from anesthesia. There are risks from bleeding, as adipose tissue is quite vascular. There is the risk of sensory loss, as connective tissue is highly innervated. There are risks of infection and fluid loss. The death rate from liposuction procedure is 1 in 5,000. That rate is very high for what is basically cosmetic surgery that provides only a temporary solution to a chronic problem. In summary, the hypodermis is a layer of loose areolar or adipose connective tissue that lies beneath the cutaneous membrane. It separates the skin from underlying tissues and is sometimes referred to as superficial fascia. The hypodermis is packed with adipocytes, and apart from substantial vasculature near its boundary with the dermis, the hypodermis contains very little in terms of vital organs. It serves therefore as an excellent site for hypodermic needles to deliver subcutaneous injections. Because 80% of body fat is found in the hypodermis, liposuction, a surgical technique that removes fat, targets the adipose tissue of the hypodermis. Join me in Module 5.6 as we learn about an accessory organ of the integumentary system, namely hair.